So we're going to talk about some pathologies of the spinal cord. We're going to start with the sort of mechanical injury known as spinal cord injury. Depending on which neurons are affected, it may result in paralysis, inability to move muscles, paresthesia, abnormal sensations or lack of sensations, or flaccid paralysis. Paralysis, paresthesia. Now, paralysis can be flaccid or spastic. So if ventral root is destroyed, as we will see soon, that results in a flaccid paralysis. Muscles do not move because they're completely relaxed. In some cases, instead of flaccid paralysis, what you can expect is spastic paralysis. So if upper motor neurons are damaged, results in so-called upper motor neuron syndrome with hypotonia, so-called or known as spinal shock. If it does not go away in 48 hours, it usually is permanent. Lack of certain reflexes. After the 48 hours, if it's not completely resolved, it may result in abnormal reflexes, hyper sort of reflexes, knee-jerk reflex, may result in spasticity. That's your spastic paralysis, when there's no inhibition of the when there's no release of inhibitory motor neurotransmitters from upper motor neurons, then lower motor neurons will basically keep muscles constantly contracted, and that may result in the loss of fine motor controls, but the crude controls will remain in place. Now, lower motor neuron syndrome is the most frequent outcome of the spinal cord injury, spinal cord transection here. It results in paralysis or paresthesia, complete lack of reflexes, progressive loss of muscle tone, and degradation of the muscle. So the transection between the T1, the first thoracic vertebrae, all the way to L, lumbar vertebrae, results in paraplegia. So basically you've got legs affected only, but arms remain functional. Now, in the transection in the cervical area, usually the outcome is quadriplegia. Now, depending on how high the transection is, you can see, so the higher the transection, the more complete the paralysis, but as a matter of fact, the transection of the spinal cord in the lower cervical region may result in a complete paralysis of the lower part of the body, but partial paralysis in hands and arms. So people can still operate hands and arms without the previous precision. Polymellitis is the infectious disease caused by a poliovirus. The initial symptoms are fever, headache, and then it may progress to muscle pain and weakness. Virus actually replicates in the ventral horn, the gray matter in the spinal cord, destroying neurons, essentially leading to flaccid paralysis. And then majority of people who suffered from polio experience complete paralysis or partial paralysis of the lower limbs. In some folks, inability to breathe results in asphyxia, usually asphyxia or cardiac arrest, but that is quite rare. Vaccine, there's no treatment against polio, but vaccines are highly effective, and in the United States, polio is eradicated. Now, another interesting disease, which seems to be partially genetic, partially environmental, is Hemotrophic lateral sclerosis, or Lou Gehrig's disease. The motor neurons in the ventral horn get progressively deteriorated, which results in the progressive paralysis, and people may lose ability to speak, breathe, swallow, although there are exceptions. Stephen Hawking didn't lose the ability to breathe. Okay, interestingly, cognitively does not affect people. So we don't really know what causes it. Potentially some environmental factors, potentially some inherited factors, maybe oxidative stress, abnormally high oxidative stress. The developmental abnormality of the spinal cord is usually called Spina Bifida. In Spina Bifida, the neural tube in the fetus does not close completely, and that may result in different severity of symptoms. So let's talk about some symptoms here. So the neural tube has a proximal end. It develops in the brain, and its distal part develops in the spinal cord. So when the neural tube does not close the proximal end, just at the proximal end, this is anencephaly. Basically, lack of the brain. It is not compatible with life, obviously, and newborns with that condition ultimately die. The lack of closure of the neural tube throughout its entire length is called craniorrhesisis, and that is also incompatible with life. So brain and spinal cord are completely open. That's lethal. Now, herniation of meninges and accumulation of cerebrospinal fluid in meninges is encephalocele. Can deform brain and can have different severity. Usually can be compatible with life, but these children will have severe developmental abnormalities. Anencephaly, defects of the formation of the skull and spinal column when the head is flexed backwards. Now, Spina Bifida. Here's the Spina Bifida occulta. You can see incomplete closure of the vertebral column. The spinal cord itself, the blue structure, is not apparently affected. The meninges are not affected, so it may actually be asymptomatic condition. And it's dangerous because if it's not detected, then, for instance, playing contact sport result in the damage to the spinal cord and further paralysis. Now, in dysraphism, there's a couple of vertebrae lacking, and this empty space is obscured by a lipoma, accumulation of fat cells. It's not a tumor. Now, you need to know several only five conditions. So anencephaly. One that I never mentioned here is microcephaly, abnormally small brain and abnormally small skull, which results in the developmental abnormalities. And here, Spina Bifida, and here meningocele and myelomeningocele. So in meningocele, you can see that meninges are protruded, and this defect is filled with cerebrospinal fluid. Again, there are few vertebrae lacking. In myelomeningocele, not only meninges are protruded, but also the spinal cord is open, sticks out. So myelomeningo. So myelo refers to the nervous tissue, to the spinal cord. Meningo refers to the meninges that surround it. Both meningocele and myelomeningocele may result in multiple pretty severe symptoms, such as paralysis with the legs, inability to control bladder and bowel, abnormal development of the brain, accumulation of cerebrospinal fluid, in the meninges of the brain, in subarachnoid space surrounding the brain, resulting in hydrocephaly, and that may impair the cognitive development, so learning and executive disabilities.